Hello, everyone. Today, we're all here to talk about your total knee replacement and your post-operative conditioning that will be happening after your knee replacement. So chronic knee pain often leads to muscle imbalance and weakness in the affected leg. Total knee replacement eliminates the pain of that bone-on-bone wear and can help to realign that joint. A program of targeted exercise and therapy, both pre and post-operatively, can ensure that muscle strength and flexibility is restored. This will provide you with the best possible outcome after your total knee replacement.
So before you start therapy, check with your joint replacement surgeon to verify that they are ready for you to start rehabilitating your new joint. When necessary, take pain medications or anti-inflammatories prescribed by your doctor 30 minutes before your session begins. Always elevate your leg and apply cold compress for 20 to 30 minutes after your session is done. Remember to keep a layer of fabric between your skin and the cold source to prevent any injury to the tissue, especially around your incision. Use caution when exercising, never flex or extend the joint forcefully. Gentle progression is the most effective method of regaining strength and flexibility. Avoid using gym equipment without supervision until cleared to do so by your therapy team. Always be cautious to avoid slips, trips, and falls during exercises. Report any bleeding, persistent swelling, or unusual pain to your doctor or therapist. So pain management is an important focus in total joint replacement. Patients undergoing total joint replacement in the past received long-acting spinal blocks and often utilize opioids for extended periods of time. This often slows rehabilitation significantly, but puts patients at significantly risk for falls. But procedures are now performing using a multi-modal approach. Slow-release local anesthetics such as Exparel and are injected into the tissue around the joint to provide up to a week of local anesthesia. Spinal blocks have been replaced with regional blocks such as the Adductor Canal block, which blocks pain signals without affecting any motor controls. If an extended block is needed, simple devices such as the Ivora simultation device can be used in the office to offer additional pain control that lasts up to a month. Oral medications such as non-steroid anti-inflammatories and nerve pain agents such as gabapentin have virtually eliminated opioid use. Non-pharmacological therapies such as cold laser are also used to reduce deep tissue inflammation. The result is a rapid and safe and pain-free recovery with improved functional outcomes.
So in addition to all of these things, there are many other available treatment plans that will help maintain long-term independence and flexibility and mobility for your new joint. Something that's relatively new called BFR is blood flow restriction. So when coupled with a regular recovery program, BFR is able to improve recovery time after surgery. Blood flow resistance training involves applying a slight tourniquet above a muscle group, which will significantly increase the gains in strength to that muscle and size relative to normal training programs. The application of the tourniquet causes a pooling of blood in that area of the targeted muscles where you are looking to recover, which provides the muscles with all of the nutrients and resources the muscle needs to activate and tear down, as well as build back up stronger and faster. An important note, these tourniquets that are put on should only be done with the supervision of a therapist or your surgeon. They can be difficult to apply and remove and require very close attention. Improper use can result in some relatively bad side effects if used improperly. Something that you should keep in mind if you have some contraindications for using a tourniquet type based treatment would prevent you from doing that. So if you've had lymph nodes removed, if there's any shunts, deep vein thrombosis, hypertension, hypotension, or any other obstruction in that lower extremity where the flow restriction would be put at, you shouldn't utilize BFR. But if you are able to do so, it will build up that strength and that flexibility quicker.
While joint health starts with your new knee replacements, it's important as a patient to make sure you do your home exercises at home. This is going to stabilize your new joint and get you back to doing the things you love the most. So the first exercise I'm going to show you here is the heel slide. And what you're going to do is keep your foot flat on the plinth. And I'm going to have Josh pull your heel towards your glute. And then only go as far as feels comfortable for you. The goal is stretching, but if you are feeling pain, that is your cue to back off. And you can do 15 reps of these, and you can do them lying down while you're at home. The next exercise I'm going to show you is called a quadricep set. And what you're going to do here is you're going to find a pillow or a towel, and you're going to roll it up and place it beneath your ankle on the side that your joint is on, your new joint. You'll stick this here, and then what I want you to do, Josh, is press your quadriceps down into the plinth so you're straightening your knee out. And this is going to help stabilize your joint while you're walking with your walker until you can build up strength to do more exercise every day. The next exercise I'm going to show you is a short quad arc. And what we're doing here is I'm going to place this here under your knee so you can use whatever you have at home. And what you're thinking when you say short quad arc is a short arc upwards. So Josh, I want you to take your heel and flex your foot and then think of making small arcs upwards and then back down. Good. And then you'll do 15 of these while you're relaxing at home. And this is going to keep you having range of motion with your new joint because it will be stiff. And it'll also build up exercise to walk and hike and do all those things. The next one I'm going to have you, Josh, do is gluteal sets. And this one's an easy one, but this is a great one. And you can do this sitting on the couch. What you're going to do is just squeeze your glutes and do that over and over again. And the glutes are incredibly important for stabilization in your gait. And when I say gait, I mean how you walk and how you place your balance from foot to foot. So this is going to stabilize those hips so that you're able to walk on your new knee with any instability you may be experiencing. I have 2 more exercises here. Thank you, Josh. And we're going to use a chair for these ones. So I'm going to pull this here. Josh, will you sit down for me? So again, this is a quadricep set. And it's just like when we pushed our knee down into the plinth. So what you're going to do is extend your knee out here and place your heel down on the floor. And you're just pushing your knee backwards as best you can and flexing it. And that's again for your range of motion and flexibility and strengthening those muscles that are here around where your incision site may have been, depending on your surgery. The next one I'm going to show you is a long quad arc. So I want you to really think of that arc motion. Flex your heel for me up. And then this is a long arc. So you're going to want to bring that all the way up and all the way down. And again, if you're experiencing pain, that's not normal. You want to feel stretch and maybe it'll be a resistance, but you do not want pain. And if you're experiencing pain, then talk to your doctor about that. The final one I'm going to have you do, or I can do this one, is just some simple knee bends. So you're going to hold the back of a chair because you may have some instability. And I want you to just bring your knee up to your glute as best you can and back down. And while you're doing this, make sure it's comfortable to sit like this. You're going to really want to tilt your pelvis forward and squeeze those glutes while you're bringing it up. Because again, we want to get you stable for your gait and your walking. And I think that is all today I have for you when it comes to exercises.
Congratulations on your new knee replacement. This is an exciting new endeavor, and we hope this program leaves you feeling more comfortable for caring with your new knee. Please direct any further questions to your surgeon or post-op team.